Hi, I have officially finished my first week of nursing school, which feels really surreal to say. Actually, it's been such a hectic, overwhelming week. I feel like the whole week I was just trying to get myself together, and it's Sunday today, and I feel like I'm finally assimilating the week. One of my biggest questions before even applying to the program, but especially once I was accepted, was what will my schedule look like? What are the classes that I'm going to be taking like? Especially the first semester, because that's where you're starting. And I would do some digging around and I gathered some information, but I just never got all of the details that I wanted to know. So I thought I would make this video to do like a little deep dive on the schedule. So first I'll talk about just like the schedule, and then I'll kind of get into what each course is like in terms of expectations and workload. And to be honest, I don't have all of the answers right now. I'm still trying to figure it out and trying to like keep track of all the courses and remember what each one is like, but I will do my best. And then once I finish, I'll obviously be able to provide a lot more comprehensive information about what everything was like. So without further ado, jumping straight into the schedule, I have it here. So I guess I should start by saying that we have some online classes and then we have some in-person classes. So it really just depends, and this can change year by year, so this is just how it is right now. Mondays, we have class from 8 a.m. to 12 p.m. This is our evidence-based practice class. And then we have a 2-hour break from 12 to 2, so that's a nice time to grab some lunch and go to the bathroom. And then we have global health equity from 2 p.m. to 5 p.m. So this is a full day. The first class is online, and then the second class is in person. So if you're thinking about commuting, that might be something to consider because you only have 2 hours to get into your class. But what some of my classmates have been doing who commute is reserving a room on campus to take the virtual class from campus. That way they have 2 hours to, grab lunch and just like be here and be settled. On Tuesdays, we have class again from 8 a.m. to 12 p.m. So this is our Science of Nursing practice class. Then we have a 1-hour break, so not quite as long of a break as the day before, but still a great time to grab some lunch. And then we have another class called Physical Assessment, which goes from 1 to 5 p.m. So again, it's a very full day. Both days begin at 8 and end at 5. On Wednesdays and Thursdays, we have either hospital days or lab days. So because there are so many of us, we got broken up into 10 different groups. And some of us have hospital on Wednesday and lab on Thursday, or hospital on Thursday and lab on Wednesday. I hope that makes sense. So my hospital day happens to be on Wednesday, so I'll be in the hospital from 7 a.m. to 3:30 p.m. every Wednesday, but this doesn't start until the 4th week of school, so I haven't done that yet, so I have no information on that. Right now, we've just been doing like testing. This upcoming week, we're gonna do a respirator fitting. The following week after that, I'm not sure what we'll do instead of hospital days, or if we just like get the day off. So for labs, this might get a little complicated. I hope to explain it as best as possible. So there are different time possibilities for labs. Firstly, you should know that there are 2 labs. So most of the times I think are just straight back to back. So we have physical assessment lab and skills lab. And usually there's 2 groups at the same time, but with opposite labs. So if I'm in there from 3 to 5 doing skills lab, there will be another group in the physical assessment lab at the same time, and then we swap. Okay, that's like a nuance that's not super important to understanding the schedule, but the times go as follow. There's one group that will have lab from 8 a.m. to 10 a.m., either PA or skills. And then they have a gap, a 3-hour gap, and then they go to their other lab, again, PA or skills, from 1 p.m. to 3 p.m. So it's kind of like an all morning and early afternoon ordeal. Another group goes in from 8 to 10 and then from 10 to 12. So it's back to back. Another group can go in from 10 to 12. And then they have a 1-hour gap, and then they go in from 1 to 3. And then the final option is 3 to 5, 5 to 7. So again, it's back to back. I say option, we don't have the option to choose. They place us randomly, but you can be in any of those times. So once you're placed in a group, that'll always be your schedule, but it's just like the different possibilities. So my lab is from 3 to 7. So first I'm in PA lab, physical assessment lab, from 3 to 5, and then I have skills lab from 5 to 7. And I'm actually really grateful that I have it in the evening, because if ever there's something that I need to get done in the morning, like a doctor's appointment or something, I have some room in my schedule. On Fridays, we are fully online, so there's no need to come in at all. And we have our first classes from 8 to 9 a.m. This is topics in nursing practice. And then we have our final class of the day and of the week from 9 a.m. to 1 p.m. And this is our pharmacology class. So in terms of schedule, that's really it. There's nothing more to it. All of our in-person classes meet in the same building, in the same room. So that kind of makes it convenient, because you don't have to like memorize 100 different places to go. That's where we take our exams and stuff as well. So all 218 or however many of us there are there at any given time. The only in-person stuff that doesn't take place there is our labs. That takes place in the nursing building at the simulation labs. Okay, now I'm gonna go through each of the course descriptions as it's written in our syllabi, so that you get a real idea of what each course is about. So starting with Monday, evidence-based practice. This course is designed to provide graduate nursing students with the knowledge and skills to utilize scientific evidence in decisions about clinical practice and to engage in meaningful conversation about scientific evidence. In particular, this course will help graduate nursing students articulate relevant practice-based questions, search the literature to identify relevant evidence, evaluate the quality of research on which the evidence is based, and describe the application of the evidence in clinical practice to improve quality of care. So just like my thoughts on this, I am not someone who naturally leans towards research, and I always knew that it was important for nurses and healthcare professionals in general, but I'm going to speak just to nurses, to stay on top of all of the newest research and literature and findings and data in order to provide patients with the best care. But I think this course has already broadened my horizons a little bit in terms of what it really means to be on top of the literature and the real life outcomes on patient care. And in this course, we have exams, we have weekly assignments, we have a lot of articles that we have to read, and we have like a big group project that's due toward the end of the semester. I think this course is pass or fail, if I remember correctly, so there's no letter grade associated with it, but I don't fully remember. Okay, my next class on Monday is Global Health Equity. The pursuit of health equity that addresses critical health disparities in the 21st century is a global mandate and responsibility. Global health equity and the responsibility of the nursing profession explores the responsibilities of nursing within the framework of human rights and social justice, and fosters a systematic global perspective of evidence-based nursing practice. Students will examine structural inequalities across the global community and develop strategies to deliver equitable care. This class, there are no quizzes or exams or weekly assignments or anything, so it seems like a wonderful class to just like learn in without the pressures of studying for exams. There are a lot of readings that we have to do and like videos to prepare for class each week so that we can participate in discussions in the most effective way. 90% of our grade comes from one group project. So we're all assigned a topic, and then each person in the group has to talk about a specific thing within that topic. And we have to make a poster and present it to our class, and that's it. We do it one time, we get it over with. We all have a date that we have to present it, and that's it. The other 10% of our class is from attendance, so being there is important, and being prepared with our readings and having watched our videos and listen to our podcasts or whatever is assigned for that week. Tuesday, our fully in-person day, Science of Nursing Practice. I think previously it was called Fundamentals of Nursing Practice, so I think sometimes they use it like interchangeably, but it's officially called Science of Nursing Practice. This is a foundational course introducing the core concepts of nursing science, including taxonomies, caring philosophies, the nursing process, and evidence-based practice. Students will explore the integration of biological, epidemiological, and behavioral sciences in the health and care of individuals, families, and populations experiencing health problems. The course emphasizes the development of critical thinking and clinical reasoning, patient-centered care, and the professional nurse's role in achieving quality health outcomes in varied healthcare settings. This course also has quizzes and exams and readings, so it's quite an involved course as well, but it just feels like our professor in particular will really like lay the groundwork for all the things that are super crucial to know right as we're starting learning about the nursing process and kind of applying all of that and all the other things that we're learning in our different courses in a practical sense during the labs and stuff. Physical assessment is a foundational course introducing the competencies required to conduct and record comprehensive and focused health assessments for individuals across the lifespan. Students develop clinical reasoning and critical thinking skills while exploring assessment findings across the health-illness continuum. The course emphasizes the delivery of safe, high-quality, and equitable patient-centered care. So in this course, we also have exams and quizzes, I think, as well as like weekly assignments, I'm pretty sure. And we also, on top of our 4-hour in-person lecture, we have lectures from the pediatric side of things, because physical assessments vary when dealing with pediatric patients versus adult patients, and our professor doesn't work with pediatric populations, never has, only like did it a little bit in nursing school. So I actually really appreciate the fact that she is just like deferring that information to someone who does work in pediatrics and is, you know, an expert in that. And so usually there's modules for the pediatric stuff, which are also like long lectures. So this course is pretty involved, but also incredibly important. I think it's helped me appreciate so far from what we've learned the skill set that is required to take a full assessment, but then, or a focused assessment, but then also to be able to chart it effectively. So yeah, in the physical assessment lab, as the semester progresses, we'll continue learning how to do assessments and focus assessments on different body systems, which is different from our skills lab. So our skills lab, the description is: Science of Nursing Practice is a foundational course providing students with a supportive and supervised environment to acquire and demonstrate the nursing skills of patient-centered care. The course emphasizes the scientific rationale underlying component performance of nursing skills. Students will integrate biopsychosocial, epidemiological, behavioral, and nursing sciences to develop critical thinking and clinical reasoning in the application of nursing skills in evidence-based quality patient care. So in this lab, we learn how to do more practical skills like wound care, hygiene, like bed baths, catheter kind of things, all of like the nitty-gritty of physically taking care of patients. So that lab is really exciting and just like cool. We do have tests in both of these labs as well. We have like practical tests, and I think it's pass or fail. So there's like regular passing, or maybe high passing, or like low passing, fail, and I think that's it. I don't know. There's like a little scale, but it is essentially pass or fail. So there's a little bit less pressure, but of course you want to do things right because you have to do them right in the hospital. And soon, in about 2 weeks, we'll be in a real hospital practicing these skills on real people and not just a mannequin. Friday topics in nursing practice. The course description is: Topics in Nursing introduces students to relevant and emergent contemporary issues impacting the practice of nursing nationally and globally. The course emphasizes interrelated theories, current trends, and policy issues that shape the profession and healthcare delivery systems. So this class is actually a 0 credit course. We don't get graded on it or anything. There's no exams or group projects. I don't think that there's like readings or anything that we have to do weekly either. I think it's a class where we like show up and learn. And we don't meet every week. We meet most weeks, but we have like several weeks where we just don't meet at all. And last but not least, we have pharmacology. So the course description goes: Pharmacology is a foundational course introducing pharmacology as an applied science building on concepts from biology, chemistry, microbiology, anatomy, and physiology. Students will explore principles of pharmacology within the framework of nursing practice. The course emphasizes relating the mechanism of action to the therapeutic use of pharmacologic agents. So there's that. This class has weekly quizzes, which are kind of more like assignments. We're not timed on them or proctored or anything. We have exams. Our first exams is like 9 days from today, which is crazy to think about because we already have a list of like, 30 medications or something that we need to know. I hope this was helpful. I tried to not make it super long, but also give as much information as I can. I was doing like a rough calculation of how much time we're in class, and it's like 21 hours a week. So that doesn't seem too bad, but someone did say that we should be spending about 3 hours of study time per class. But because some of them don't, like the topics in nursing doesn't really require preparation, and our global health equity doesn't have any exams or anything like that, I'm gonna say there are 6 classes for which we need to study. So 6 times 3 is 18 plus 21. That's like 39 hours of class and study time. But then if you think about all the reading that we have to do for each class, the assignments that we have to do, which more or less seem to take about an hour per assignment per class. That one I'm actually going to say 7 hours a week, because even though we don't have to study for the one class, we do have to read and prepare. So I think I said 39, right? Plus 7, 46 hours. And then for our labs, we have to do open labs, and we have to do that 4 times in the first semester. So that's another 4 hours. I think I was at 45, so that's about 49 hours. Anyway, yeah, it quickly adds up. So that's not even me including like reading time and going over lectures again, which are really long. It's a lot of hours. It is a lot of hours to put in, and it can feel really overwhelming, but it also feels really fun. At least for me, it feels really fun. But yeah, again, I hope this was helpful. If you have any questions, I'm happy to continue updating and like, I don't know, talking about whatever is like a pressing question for anyone. And thank you for all the new people that have subscribed and that are interested in this kind of content. I think it's a really wonderful decision to come into nursing. I never thought I would be here, but I am just like every day falling more and more in love with just like how wide nursing is and just like the scope and what it really means. And so I encourage you to take your decision wholeheartedly. And you know, this program might not be for everyone, and that's okay, but from what I'm experiencing so far, I'm very pleased with the level and quality of instruction that we're receiving. So I have high expectations, and I hope that it continues to meet and even exceed those expectations. Okay, I'll catch you in my next one. Bye!